I still remember the moment that question first crossed my mind. How could someone be doing everything right, brushing every single day, never skipping, and still feel like something was slowly going wrong? It didn't start as fear. It started as something subtle, almost easy to ignore. At first, it was just a little blood in the sink. Nothing dramatic. Just a faint pink swirl after brushing. Something most people see at least once and immediately dismiss. I told myself the same thing most people do: it's probably nothing. Maybe I brushed a little too hard. So I kept going. Day after day. Routine untouched. But then it kept happening. Not once in a while, every day. And that's when the doubt began to creep in, quietly. Because deep down, something didn't feel right. If brushing is supposed to protect your mouth, why did it feel like mine was getting worse? I started paying closer attention. Every time I used dental floss, there it was again, that same bleeding. Consistent. Predictable. Almost like a signal. One I didn't fully understand yet. And here's the strange part. No one really talks about it. People normalize it. They ignore it. They laugh it off in casual conversations. They make jokes about aggressive brushing or tough gums, as if pain was somehow a badge of honor. As if the body's way of screaming for help was just character. I did that too. For longer than I want to admit. Because it's easier to minimize something than to face the possibility that you've been doing it wrong all along. But the more I observed, the more it felt like I was collecting small pieces of a puzzle that didn't fit the story I had always believed about oral hygiene. And the strange thing about patterns is this: once you start noticing them, they stop being coincidences. The bleeding wasn't random. It happened in the same spots, the same areas. Like a map I didn't know how to read yet. Sometimes it was the back molars. Sometimes the inner gum line near the front teeth. But always in places where I thought I was being extra thorough. That irony hit differently. Because I wasn't neglecting those areas, I was attacking them. Then came the moment I couldn't unsee. One morning, while looking in the mirror a little longer than usual, I noticed something different. My teeth looked longer. Not dramatically. Not in a way that screams for attention. But enough to make me pause. It wasn't the teeth that had changed. It was everything around them. My gums were slowly pulling back. And once you notice that, you can't unnotice it. I tilted my head. Changed the lighting. Leaned closer. Hoping it was just a trick of perception. But it wasn't. The gum line that used to sit firmly against the tooth had moved. And in that gap, that tiny, almost invisible space, was where everything started to unravel. That's when a different kind of discomfort began. Not just physical, but psychological. Because it's not just about sensitivity, it's about the fear of losing something that always felt permanent. Your own teeth. And here's what no one prepares you for. That fear doesn't arrive all at once. It builds. Slowly. Every time you smile in a photo and wonder if people can see it. Every time you run your tongue along the gum line and feel that unfamiliar texture. Every time you brush and worry that you're making it worse. That's the trap. Because at some point, the thing you trusted to protect you, your daily routine, becomes something you're afraid of. I started questioning everything I thought I was doing right. Because the truth is, brushing every day isn't the full story. In fact, in some cases, it can actually be part of the problem. Let me explain. I had always believed that brushing harder meant brushing better. More pressure. More scrubbing. More results. That's what it felt like, anyway. But gums aren't tile grout. They're living tissue. Delicate. Resilient when treated correctly. But shockingly fragile when subjected to chronic microtrauma. And that's exactly what I was doing, creating hundreds of tiny wounds day after day under the illusion of cleanliness. And this is where things began to make sense in a way I didn't expect. But before I get into that, if you've ever noticed bleeding when brushing or flossing, even if you brush daily, we've left a practical guide in the first link in the description and in the pinned comment. It helps you understand why this keeps happening and what might be behind it. Because what I discovered next changed everything. The discomfort didn't stay subtle. It evolved. Cold water started to feel sharp. Hot drinks? Uncomfortable. Sweet foods? Almost instant sensitivity. And here's the thing about sensitivity. It teaches you avoidance. You stop ordering iced coffee. You let tea cool down longer than it should. You skip dessert even when you want it. Not because you've made a health decision, but because your body has made one for you. And slowly, without realizing it, I began avoiding things I used to enjoy. That's when the mental shift happened. Because food isn't just nutrition. It's comfort, memory, social connection. And when you start reshaping your life around what your mouth can tolerate, you realize how much power this small issue actually has. That's when it hit me. This wasn't just a minor issue anymore. This was progression. Something was changing, even though my routine hadn't. And that word, progression, carried weight I hadn't felt before. Because it implies direction, movement, a trajectory you're on whether you acknowledge it or not. And the terrifying part? I had no idea where it was heading. How far back would the gums go? How sensitive would things become? At what point does discomfort turn into damage you can't reverse? And that's when I stopped assuming and started learning. What I found is backed by real dental research and clinical observations. Gum recession and bleeding are often not caused by lack of hygiene, but by how that hygiene is done. Things like brushing too hard, using the wrong technique, applying excessive pressure with a toothbrush that feels effective, but is actually damaging delicate gum tissue, using a brush with bristles that are too stiff, brushing horizontally instead of at the correct angle, rushing through the process like it's a chore to eliminate, not a ritual to protect, and even underlying gum inflammation that isn't visible at first, but slowly weakens the support structure around the teeth. This inflammation, called gingivitis in its early stage, is deceptive, because it doesn't announce itself. There's no alarm, no dramatic moment, just a quiet breakdown of the connection between gum and tooth. And by the time you see the gap, the damage has been compounding for months. It's not immediate. It's gradual. And that's why it's so dangerous to ignore. Because by the time you feel the difference, it's already been happening for a while. Think about that. The moment you notice the problem is not the beginning. It's the middle. Or worse, it's closer to the point where intervention becomes harder. Where reversal turns into management. Where fix becomes slow down. But here's the part most people don't realize. This process can be interrupted. Not with extreme changes. Not with complicated routines. But with correct understanding and small adjustments backed by evidence. Switching to a soft bristle brush. Learning the proper angle. 45 degrees toward the gum line, not straight on. Using gentle, circular motions instead of aggressive back-and-forth scrubbing. Giving attention to the gum tissue itself, not just the tooth surface. And recognizing that oral health isn't about force, it's about consistency, technique, and respect for living tissue. And if you're dealing with gum recession, sensitivity when eating or drinking, or that constant feeling that something isn't right, we also left a method in the first link in the description and in the pinned comment that shows exactly how to approach this before it turns into something more serious. Because once I connected all these dots, everything changed. The fear turned into clarity. The confusion turned into awareness. And most importantly, the sense of losing control started to fade. Because control doesn't come from doing more. It comes from doing correctly. And that shift, from effort to precision, is where transformation actually lives. Because when you understand what's really happening, you stop reacting and start acting. You begin to protect what you still have. And in many cases, prevent things from getting worse. You start treating your mouth like the early warning system it actually is. Because gum health isn't isolated. It's connected to systemic inflammation, to cardiovascular markers, to immune response. Your mouth is trying to tell you something, and learning to listen might be one of the most important skills you never knew you needed. That's the difference between guessing and knowing. So if this story felt familiar at any point, if you've ever noticed bleeding, sensitivity, or changes in your gums and thought it was normal, maybe it's time to look a little closer. Because sometimes the biggest problems start in the smallest details, and they only stay invisible until you decide to see them. And once you see them, you can't go back to ignoring. But that's not a curse. That's the beginning of agency. If you want to keep learning how to take care of your health in a smarter, more informed way, make sure to subscribe to the channel, because this is just the beginning of everything most people were never taught, but should have known all along.